Hi, everyone. I'm not exactly sure everybody that's on right now. Let me see all of my wonderful colleagues. Today, we are presenting, from ESO is presenting kind of an update on some of the things that they've been up to that may be interesting for our state trauma program managers and our state registries. One of the things that this comes directly from our annual meeting that we had when we were in South Carolina, and it was basically to see if we could partner with ESO to get a webinar. And so Garrett is here today. He's going to really help us out. And I'm sorry that I sound kind of bumpy, but it's kind of odd for me to be talking to none of you actually, but talking to all of you. So I'm going to turn it over to Garrett. And at any time, if you have questions, go ahead and pop them into the questions box. It's on to the right side on your control panel. There's a little arrow that says web or like questions, and you can chat in there. Anyway, here we go.
Well, yes, Kelly, thank you for the invite. Thank you for NASEMSO and the Trauma Managers Council for inviting us to speak and talk about state trauma registry data submissions, just an update from ESO in general for you all. I actually have myself and my colleague, I believe Julie. So Kelly, if we could get Julie added as a co-presenter, that would be great. We're going to be presenting and sharing a bunch of data with you and information from the ESO standpoint, and then also we'll wrap up at the end with just a great opportunity for Q&A, any questions that you may have. If we don't know the answers, we'll find out an answer and get back to you all. Julie, are you able to jump on with us? There you are.
Hi.
Great.
Let me try out my video. I apologize. There we go.
So Julie and I will be here presenting to you. So it's really important. This drives home ESO's mission to really make a difference and improve community health and safety through the power of data and ensuring that your state entities have access to data in a timely manner. We're going to start off by really focusing in on just our state compliance components. And so you have myself and Julie. So as mentioned, my name's Garrett Hall. I'm the Senior Director of Hospital Programs here at ESO. Past experience, over 20 years in the actual trauma registry realm. Started out as a registrar, worked my way through nursing school, became a program director, and then left after getting my graduate degree in biomedical informatics and moved into the clinical software application side here at ESO with designing our new patient registry product, which I'll share with you guys in a bit. Super excited about that. And along the journey during those 20 years, I ran across Julie. We worked together in the trauma space for quite some time. And she is also a nurse clinical informaticist. And she's come over to join us here at ESO to really oversee our state compliance component. So what are the two of us going to talk about with you all today? We're going to talk about just state registry compliance, the future of ESO registry and state applications, compliance with the new ESO patient registry, and have an open forum for questions and answers, any questions that you may have. So as I mentioned, Julie, just great introduction, for a quick introduction for Julie. Really the big thing here on the slide, make sure you take down, if you can, her email is listed there at the bottom. She is the person who handles all, she's our product owner for all registry compliance. And we'll talk about what ESO calls registry compliance, just to make sure we all have a clear understanding. She is the partner for states, regional, and collaborative customers with implementing and rolling out annual updates for registry data collection. So any of your annual updates or dictionaries within your states, she would be the point person to reach out to and talk with. She is not support, so we'll put a little caveat there. We do have a support team. We'll share with you guys some support information. Her primary focus is to ensure that we are good partners with each of you in any updates that you have from your data dictionaries and your data standards in your state, that we're getting them rolled out and executed in a timely manner for all of our ESO product families, whether that's the DI products, CDM, or Lancet product families. She's also responsible for ensuring that our products interface and work well with other third-party vendors to ensure data is submitted into the appropriate state applications. So Julie's just going to give us a quick rundown from Julie's perspective as to what is state trauma registry compliance.
Hi, everyone. Thank you so much, Garrett, for that introduction. So just wanted to highlight what is state registry, trauma registry compliance. We do take a look at national and state data dictionaries and make sure that we update those annually as applicable for y'all. And then we'd also make sure that we look at our national and state validation and submission updates, so that way the flow of data can communicate with any updates being made. And then next, we also look at our ICD-10 diagnoses and ICD-10 procedure codes, and those now by CMS are being updated biannually. Let's go on next slide.
There we go.
Garrett, if you're speaking. Oh, there you go.
Thank you, Julie, for that update on state trauma registry compliance. So really, we want to go into a little more detail. Oh, this is a great slide that pops up. Whoa, I went too fast. There we go. So we want to go into a little more detail and just share with you all the registry compliance timeline and help give an understanding of what level of effort goes into updating all of your individual hospitals who report in trauma data to you. So we're just going to start in a ideal scenario. So an ideal scenario is that here at ESO, we would have all of the state updates for the next year. So we're in 2022, we would have all of the state updates for 2023 by July, August, and September. At the latest September, but that still would push things out, but really July. And what we need there is it takes 90 days for Julie and the team to go through the development process of completing an analysis for each of the product families that exist out there for all the states and all the regions within the states, and then actually even all the way down to a county level where there are some registry applications at that level. Complete those analysis and review. It takes about 90 days for us to complete that process. And then it ranges from, once we've completed it, it ranges from about 30 to 90 days to roll out these updates to users so that they can start to collect for submissions to your state. So 30 to 90 days, it really varies on a few things, whether the actual user is scheduled, server updates, all types of things for those individual hospitals, because these products are on-prem for most of the actual facilities that are submitting data into y'all. After that, that allows us to hit that target submission for submission of January for data entry. And then we start over the whole process again for first state. So the first state submission technically would probably be February. The earliest we know is from January discharges to submit by February. So we'd have the earliest state starting to submit in data by February. It's a long drawn out process you see here. It's approximately 240 days to complete what we call the ESO registry compliance timeline. So it's super, super imperative that we partner with you all. And we share some insight into what takes so long, but we also gain some insight as to when each of the states plan to obtain or have rolled out their actual compliance updates or their data dictionary changes. So there's some really big dependencies in this area of compliance with the registry. So that 90 to 120 days to complete our analysis and changes received and put it into product development really is dependent upon the time of when we receive it. Obviously, if we received all 50 states submissions and their data in July, that could potentially push it to more the 120 versus 90 days. Normally states come in staggered, or even regions come in staggered when their actual updates are going to take place, but it really is dependent upon when we actually receive that update to go through the process. And there's 30 to 90 days to schedule and deploy updates, all dependent upon whether we're able to get scheduled in with those individual facilities, and then also at the state if we have to update the state-specific application. So really big additional dependencies are those states that are dependent upon the annual release of the National Trauma. I apologize, y'all. Those states that are dependent upon the ACS National Trauma Data Standard Data Dictionary release, we understand that that's a big dependency, and most states cannot move forward with their actual submissions until they have that data dictionary, because they're dependent upon ensuring that they have their standards matching the national standards. So with that, we also then have those states that have dependencies on the ESO International Trauma Data Exchange Standard, which is the International Data Exchange Data Dictionary that's released by ESO, and it does consume part of the NTDS within it, but goes a little beyond that. So those two things are very big dependencies in most cases for states to review and analyze if they're going to update their data dictionaries. And then the next one, not the last one, is state and regional actual data dictionary releases. We're very dependent upon getting those data dictionary releases to ensure that we can implement any data changes within the software to make these updates. There's another big point here that many people may not even realize, but outside of the National Trauma Data Standard and the ITDX data standard, or even your state data dictionary standard, there's a whole bunch of data points specific for national state verification and designation. Those data point updates or changes also have to be integrated within this development cycle. So right now we're going through, for those states that are verified and verified by the American College of Surgeons, as you all may know, the new gray book was released. We're going through and implementing and reviewing the data points specific to the gray book that centers would need to track or report out on in order to maintain their verification. So that's an additional layer of updates outside of the actual data dictionary process that does have to be integrated into this. And then, as Julie mentioned before, we're now moving from an annual coding update to a biannual coding update. So codes will get updated in both, so they go into effect August and October of, April and October of each year. With that, there would be 2 update cycles for diagnosis and procedure codes based off of the new Centers for Medicare and Medicaid Services and the CDC of those now twice a year. And really a lot of that is from lessons learned with COVID and the need to have a more contemporaneous data and quick access to specific codes, specific disease conditions. So let's chat a little bit about what an actual state compliance timeline case study is from the ESO software standpoint. And really what we do is we first look at the actual state and we say, okay, what is the state's regulatory requirement for submitting data to the state? Most states, it can range from 60 days, some 30, it could go up to even just quarterly submissions or maybe even annual submissions for a state or region. But it's really important that that information is changed. If that information is changed or updated at a regulatory level, whether by state statute, law, or however your guidelines are established, that information gets shared out. We try to stay on top of that and partner with you all here at NASEMSO and other organizations to find out if there's any changes. For our case study here, we have a state which has a 60-day from discharge deadline for January trauma patients, which essentially means patients at the end, from January, those patients at the end of February, start of March have to start being submitted to their state repository. So we start there and we work our way back. So we know that it's for January patients. So you'll see here we have January 2023 is when the states in our little case study state needs to have the data entry screen. They need to have the data points there ready to do data entry so that they could submit by that March deadline. So if we work our way back, the latest we would like to deploy that would be in for 2023. We want to deploy it in December of 2022. Remember, I walked you through just a little bit earlier the actual change analysis and development rollout cycle. You can see this listed about 150 days when combined. So that would take us back to June of 2022. So in a perfect ideal scenario for a state that has a regulatory requirement for trauma centers to submit data within 60 days of discharge from January or to the state, that would be by March, the actual state's data points and information would be needed to be processed at the latest by June of 2022 to go through this process for change analysis, development, and deployment into the software application, and then release to the actual user for data entry so they can meet their March deadline. I just want to pause there and see if there's any questions so far, because we've covered a lot of information in regards to just the inside workings of how compliance works here at ESO, and just want to open it up to see if there's any questions, conversations, or talks from our partners at the state.
So I've gone ahead and unmuted everybody. If there's anybody that wants to pop in, any question right now, either here or in the questions box. If not, all right.
All right. Well, you may think of them as we go along. We'll keep on trucking, and Kelly, we'll also. We'll also make these slides available for, with Kelly so that she can share with them if there's any other questions that may pop up. And you guys will have our emails too, but we'll continue right along. So now this is the time where we do ask for some participation from all of those in attending. So we just have a question, and you can post it in the chat box if you don't want to unmute and speak, or we just want to know, what is your state's submission requirement? So we got 14 folks on here, so we'd love to just hear from each of you, if possible, as to a quick, what is your state submission requirements for trauma data into the state registry? And Kelly, I can't see everyone, so if you want to maybe help me out, we can maybe ask some folks, or they can post in the chat box.
Just 1 second here. Of course, my phone rings at this second. I'm trying to get everybody unblocked again. Thank you for your patience, everyone. Okay, everyone should be unmuted now. So go ahead again, Garrett, sorry.
Yeah, so we're just looking to see if anyone would share their state submission requirements for trauma data.
So Garrett, could you be maybe a little bit more specific? Maybe they need a little bit more specificity than all of their data standard.
So what is their submission requirement? So is it 90 days from discharge? Is it 30 days from the last admit? Or what each state has a variation of requirements for when hospitals have to submit data into their state registries. I'm just curious what the folks that are on, what is your state submission requirement? You can post it in the chat, or you can unmute and share with us.
So it looks like Joe from New Albanese, hi Joe, said that previous quarter is, sorry, somebody really wants to get a hold of me. clearly. The previous quarter is due by the end of the current quarter. And Jamie Silverberg, hi Jamie, says we ask that they ideally submit within 30 days of incident, but it is not an administrative rule. And then we've got Chris, submission requires cases to be submitted within 60 days post-discharge. And then, Eileen said that they submit quarterly, and the dictionary definition are not definite until August and TDB. Eileen, I'm not sure what that means. Are you able to speak? If not, just type in no.
I'm unmuted, so can you hear me?
Yeah.
So my state trauma database manager monitors the TQIP and the new data dictionary. If there are going to be any changes, we don't usually find that out until August or January. So they start talking about it in August, and then they are, made permanent in January. Does that make sense?
Yeah, so you guys adopt you finalize and adopt your new standard in January.
That's NTDB does, yes. So they start talking about the NTDB data dictionary in August, whatever those changes are going to be for the following year. And then they're formally put into the data dictionary in January.
Okay. So that is, and I'm sorry, what state are you with?
Michigan.
Michigan, okay. So that is very, and that's where some of the challenges lie. Ooh, getting a lot of feedback here. Is when the actual finalization of data dictionaries, it's just across the board, as you guys heard from the folks who typed in and shared, that there's across the board variations from each state to state in regards to their submission requirements. And then we jumped into with the Michigan what their actual state data dictionary process was, and they wait. They're dependent upon the National Trauma Data Standard.
Yep.
To get that released, and then they finalize their dictionary by January. That's where it comes into play, and it's just, I think it's really important. I don't know how much has been shared in the past, but we really want to share with everyone is once it's finalized at the state level, it's not an instantaneous that voila, unless you're only adopting the NTDS changes, then it can be quickly adopted because those NTDS changes are announced in August and roll through the development cycle. But if there's any changes or variation from NTDS specific to your state and they don't get finalized until December or January, it's important for everyone to really realize that those updates cannot get deployed and rolled out to all the centers for at least 120 days. So then that automatically puts their backlog in the hospitals that they have to go back and retro collect records from that time frame where the actual compliance did not, their actual software update doesn't take place for 120 days from after the finalization release to the state. And what we've experienced, go ahead.
This is Eileen again. So can you tell me how this is different from what we've always done? I have not appreciated this lag in what my facilities do in terms of adopting the data dictionary. I thought it was finalized in January, and that's when they started collecting those data elements under those data dictionaries.
Yeah, I think that's why we wanted to really talk about this, because I don't think everyone we fully shared that in an effective way in the past. So like when I was sharing up here on just the compliance timeline here. So this says July, right? So this is July and August is normally around when we get the NTDS draft or the finalization from them.
Yeah.
And so getting that in July or August, it takes us all the way until November, December timeframe to actually implement the changes that they've rolled out.
Yep.
And
okay.
Then we have to do the actual deployment to each of the actual facilities. So some of these are on-prem, on-location installs. Do the deployment to get it ready for January. So if we, in this case scenario, I'm just going to throw this out there, not to just point out Michigan, but in general, if we were not to get a actual data dictionary finalization copy from the state level, so we got the NTDF, but we weren't able to get the state one until January. You could see here that it's automatically pushing it out approximately 6 months before the centers would actually have those new data fields deployed into their actual registry. Now they may have the NTDS fields, but if the state makes any changes to those NTDS fields or does not fully adopt them the way the American College of Surgeons rolled out, then it could push out the delay for those individual facilities to actually have those data points in their registry for up to 6 months, because it has to go through software development cycle.
Got it. I have another question, if you don't mind.
Yeah.
ITDX is the software collection tool, for a better word from an amateur, that's collecting aggregate information from those disparate registries that you purchased. Is that correct?
So ITDX, just to give you all, this is a great question. ITDX, the actual history of that is it was designed to try to unify just states, but also internationally. There were a lot of centers, hospitals across the globe that were using the NTDS data dictionary standard, but as you guys know, each year they may retire a data point, they may keep a data point, they may change it. So ITDX is really beyond NTDS, and there are much more data points there. It was designed to be a universal international standard for trauma data. And it does allow for using that standard, all three of our legacy registry, what we call legacy registry products, the DI, Lancet, CDM, they are all formatted to be able to produce a ITDX data file for submission.
Okay.
And we also share that with our third-party competitors such as ImageTrend or other folks that actually design to the ITDX standard.
Thank you.
Yep.
This is Kelly too, and Joe just put in the questions that basically we know that the 2023 NTDS standard is out. It generally comes out at about this time of year, maybe July, August. So you can always get your hands on what the new standards are going to be a bit ahead of time. Occasionally they'll change them at the last minute, but not very often. I think I'm right on that, right, Garrett?
That's correct. I don't want to speak for the college, but they normally try to limit the amount of updates from my experience because so much work and development from a software standpoint goes into these data standards once they're released from the college. So if you are a state that has simply adopted the NTDS or the ITDX standard as your state data standard, then great. You get to, it's pretty smooth sailing. As soon as we get that in July or August, it goes through the cycle and those software applications are updated for those patients on January 1 and the data points are there. When you go beyond that scope or you go outside of what is in the National Trauma Data Standard or the ITDX data standard, that's really where the actual additional development, additional resources, and the additional delay comes in. And so if states are able to share with us, like, yep, we're only following NTDS or ITDX without modifications, then that simplifies the process quite nicely and makes it much faster process for expediting and rolling out updates to all of the hospitals so they can get data into you all on a timely fashion. When you go different outside of that scope is when we start to run into this timeline of we need to know, okay, so let's look at when you're going to actually finalize your data dictionary. So in the case, and I'm not picking on Michigan, but thank you for speaking up. So in the case of Michigan, Do you all make any changes or make any updates to your data dictionary that are outside of the National Trauma Data Standard?
No, our statutory requirement is NTDS, so that's it.
So then you're smooth sailing, and that's you guys will, your centers should have their data updated and able to collect it in a timely manner.
We did elect to keep the EMS data elements in. NTDS has removed them, but we are keeping those in, and right now we're keeping that data dictionary as is.
Gotcha. That makes a lot of sense, right? Because those did get eliminated. So you guys are using the optional EMS data points that is in the optional appendix section of the NTDS.
Correct.
So that's a perfect example. If you've adopted that and you've adopted that as your state and that's your statutory requirement, then you're great. You once that NTDS comes out, the only variation that I could see of stumble block that we'd run into is there's two components to compliance. One is the actual data dictionary, but then is for each of your states, whoever your actual software vendor is, that vendor usually generates a file format, which is the acceptable file standard for hospitals to submit data into your state registry. And ensuring that that is received, so they'll be able to collect the data. The actual file standard is for the data to actually come out. So in order for the data to come out and get submitted to the correct entity, state organization, or regional organization, the states would and their vendors would need to work to publish their actual file, their what is commonly referred to in most places in XSD file format, which is sharing how the data has to be submitted. More technical language, but that sometimes does cause some stumbling blocks if there was any updates to the software application or they reworked how files should be submitted in. Even if the data standard is set in stone, we also need to make sure that the file format for submission stays set in stone too. Great conversation. This really opened it up to, we had some good talks. I appreciate the folks from Michigan stepping up and sharing with us how their data dictionary process works. Is there anyone else that has a process that may be outside of NTDS, or you encompass more data points than the National Trauma Data Standard for your state trauma data dictionary?
So this is Kelly. I can speak to what Wyoming used to do. I don't know what they're currently doing, but when I was in that role, we had a lot more data points in our, what do you think that, I don't even know. We had a lot more data points because we ran a full registry for the entire state. So it wasn't just NTDB. We had a lot of other state desired data points in our data dictionary.
And so Kelly, did you have a process that you guys went through? Did it have to go to a state committee? And was there any statutory requirements that your data points had to go through a state trauma committee, get approved and embedded and then put into your dictionary, or was it more streamlined, a faster process?
No, there was no committee that it had to go through, but remember, it's a pretty rural and low number of data records in general, but we did not get them approved through a bigger committee. I don't know how they do it now, though.
Gotcha. Because that brings up a great point. What we've learned along the way and what we see from states is that there's variations from state to state as to how data dictionaries are updated. Some states, the data points actually have to be presented at their state trauma committee, vetted for approval, and then get approved and go into the data dictionary. So you all can just imagine if your state is dependent on the National Trauma Data Standard, which gets released in August, and then you have to review that standard at your state level, identify potentially what data points that you guys may add or accept or not accept, take it through your regulatory body, committee, whatever it may be for approval. It just further pushes out that timeline as to when your hospitals could be compliant for submitting data. And holistically, I do not believe that we've all taken a look at this as to how it really does impact the data and the potential delays that may be caused just from the development cycle. But the good news is that we do have our new solution, and I'll share with y'all that in a bit, that's coming out, which will alleviate this long time frame that we're expanding upon here in our presentation with our current case study of our legacy products. One thing that we would like to ask, and Julie's going to talk about this a little bit, because as you just heard here, the difference between Wyoming and Michigan is we do have a compliance survey. And Julie, you want to speak a little bit more about our compliance survey and how we can be a better partner for the state?
Sure, absolutely. So since onboarding with ESO, I have generated a compliance survey, and this is really, as we've heard in the previous groundwork, is really we want to partner with our states and regions to really understand what your regulatory requirements are for your state and region. The nice part about this survey is once you have the link that's on the screen here, or you can use the QR code to pull that up actually live right now, you can update that at any time. As we know, dates may change due to regulation or not having to go through a committee. Your committee date might change. You're welcome to communicate that via this survey at any time. I do get real-time updates as soon as it's submitted that I can just go ahead and take a look in the background to build that timeline. Some of the questions that are included, but it is not limited on the survey, is understanding what is your submission timeline. So start of the new year, what is your first submission deadline from your hospitals? And what kind of data schema format or requirements you are requiring for your trauma centers. And then if applicable, if you do have facility or agency updates, registry inclusion criteria changes, and then AIS version to make sure that our software is up to date to accept different AIS versions. And then also, what does your data submission export look like? And then also, we'd like to partner if you do allow for ESO to participate in your state trauma meetings. We do like to be able to at least send one individual, if not myself, or someone from customer success to partner with y'all at your state trauma meetings.
The survey is a really powerful tool that Julie's created to help us get the most accurate information to ensure that we're collecting the data needed and are able to meet your state-specific deadlines for submission to partner. It's also a useful tool for issues such as, like Julie mentioned there, understanding what is your registry inclusion criteria. As many of you know, if you are a state that followed NTDS, the National Trauma Data Standard, a few years back, decided, one, not only were they going to no longer collect EMS data, as you heard from Michigan, and they've chose to continue to collect that optional data, but they've also chose to remove burn patients from the inclusion criteria for the National Trauma Data Standard. So it's really important for us to understand, because it does impact the data that gets submitted onto your state. What is your registry inclusion criteria? Is it in statute that you follow the NTDS inclusion criteria? So when they update and change to remove burns, burns are no longer going into your state registry, or do you have the ability and authority to establish your own inclusion criteria for your state? Those are really important and essential data items that we need to know to ensure that we're being the best partner for you all and ensuring that you're getting the most accurate data submitted to your state registries. So in addition to the actual compliance survey, as Julie mentioned, that's created, there's also a registry change notification. And we have this specific email. Again, we'll share this PowerPoint. Kelly can share it out with everyone. But we have this trauma.compliance@eso.com. This is the email address where you at the state can send in your XSD, your file formats, your data dictionaries, any change logs that you may have, updates to your inclusion criteria, any updates to your EMS and facility list. If you have new EMS agencies, new facilities, and you're updating those lists, please share those, send them into trauma.compliance. It's really intended only for those compliance updates. So if you do have hospitals or you're at a state where you actually have some sort of support questions, or maybe the registry's down, or there's an issue with a specific data point not functioning correctly, all of those would go into, depending on which product is being used, into our specific support team for assistance there. So just want to differentiate the two really clearly. The compliance folks and Julie are really focused in on any of your data dictionary changes, your change logs, inclusion criteria, EMS facility list updates, or the actual file submission format. When we receive these, we will go through what we call a vetting and verification and validation process for the actual files. So Julie will reach out to both the state, and if there is another vendor involved, reach out to the state individual contact and that vendor to confirm that this is the final version of their data dictionary and it's ready for us to complete the analysis, to do the development work, to deploy these updates and changes to each of the individual hospitals' applications, but also, if you are a state customer, to your actual state application too. So that was a lot of information. We talked a lot about compliance, because it's really probably one of the biggest struggles in just getting data into the states, is making sure that we have the actual registry applications updated all the way down to the individual facility level, so that that good, clean data can come through to you all. The next part that we were really excited to talk about is just the future of ESO patient registry in states, and I'm sure this will probably open up a bunch of questions, and we'll save time here at the end for questions. So we have, what is the ESO New Patient Registry? So the New Patient Registry that we're going to be rolling out in 2023 is what we consider a next generation software. It totally revamps and changes the platform of what are the ESO legacy registry products, those that we purchased through our acquisition of Digital Innovation, CDM, or Lancet. We're going to totally revamp those. We're moving into a patient-centric design. You can see here on the screen, this is a patient-centric design, so no matter what specialty it is, scalable, expandable, what specialty the patient, no matter what specialty, they're all lumped into this registry, whether it's burn or pediatric or trauma, if you break them out separately, or even if it's cardiac, stroke. All of those specialties can flow into our patient-centric registry. It will have it in a view where you can view all the records for a specific individual. It simplifies the data collection process for registries. It allows for integration and linking of data between both the hospital, a specific EMR, using the new L7 standard FHIR, FHIR, to intercept and receive data from the electronic medical record. And it also receives data directly into the registry from EMS if the patient was pre-hospital transport through the NASEMSO data standard data set can be imported directly into the registry. Big time saving for the trauma centers. They don't have to hunt down and collect or find EMS data. They run sheets. They can actually just import the data in. And it really empowers those service line leaders at the actual hospital level to drive insights and improve quality of care. And how does this impact y'all at the state level? What this does is this really impacts, and this new next generation software is designed to drive to be more I will say more contemporaneous, more real time for data exchange and transfer. So it is being built in a platform where you would no longer have to, if a state chose, you could get near real time updates to actually of the data as entered in, saved, validated, and it can transmit real-time updates of data submission, similar to how EMS data transfers and flows. So our ESO patient registry does have built-in data validation. So a big part of what we spent the first part of us talking about was compliance and regional, state, national compliance. Compliance incorporates a component of data validation, ensuring the data points that are entered into the registry software meet the actual state's requirements based off their data dictionary or the National Trauma Database. With our new software application, compliance is built in based off of the submission organization where the individual will be submitting the record, and it allows them to see real-time validation of the record. Will require them to address any potential validation errors or issues based off of the state published data dictionary. And then once they lock the record, it will then make the record available for immediate transmission or to be uploaded to the state for submission. So it streamlines the workflows, and there's a lot of self-service configuration. So one of the big compliance things you heard mentioned by Julie and both myself are any lists or updates of your facilities or EMS agencies. That all goes away and can be self-configured at the individual facility level based off of the list provided by a state, or can be configured if a state purchases an application for an entire state, can be configured at a state level. No more having to wait for development or other processes to get these actual self-configurable lists updated. And then of course, it has the possibility for performance improvement and patient safety across the board for the registry applications. So our ESO patient registry uses ESO Insights for real-time reporting. With it being a SaaS-based product, we can generate these dashboards in real-time reporting. There's an example here of EMS data and operational response times. Same dashboard process is being built for the hospital space. And when our state solution is released, it will also function and use our Insights tool where you can types of dashboards or actually drive into individual reports as you would like to. It does allow for you to calculate custom matrix. So if you want to build or establish thresholds for alerts or compare performance, and you can also build out reports which would allow for you to initiate risk-adjusted benchmarking even at a state level for your state organization. So it is, how do we accomplish all of this? And we accomplish all of this by one, our main goal is to reduce the amount of time for compliance, and I'll talk about that here in a moment. But we do that all by moving from the current state where many of these registry applications are in what we call an on-prem or on-site location. It is expensive for the individual hospitals. There is additional expense. There's more downtime. It's time consuming to install those updates, as we mentioned just from the compliance update, and it's ongoing maintenance that has to be made. So with our transition to our new product, it moves into the future where we are using a SaaS-based product. There is minimal time to download and deploy patches and updates and secured virtual environment. We have millions upon millions of records right now in our secured ESO environment using our SaaS-based applications, whether it's from our hospitals all the way from the time of injury with our EMS and fire folks all the way through to our hospitals to time of discharge currently already in the SaaS environment. So we have a proven track record there with our SaaS products, and we continue to roll that out and hopefully bring in to the registry and registry space as a whole. So what does new patient registry compliance look like? And I'm really excited to share with you guys this, oh wow, really quick, doing some weird things.
Hey,
Yes.
Garrett, before we go any
Yes.
farther, we had one of the gals left that had a question, but it looks like Eileen has a question. She's got her hand up, and everyone is unmuted right now. So if you have a question that you want to just like ask now before we go on, that'd be great.
So this is Eileen again. So one of my questions is, so I have an epidemiologist who works in my division, trauma and EMS. And we want to be able to pull down large data sets to do some comparison and many multiple incidents. How easy and accessible is that for us to do?
Yeah, so with our insights application and it being in a SaaS product, so I don't know if you guys use do you guys use Tableau, or do you use Stata or SAS, or do you use some
SAS
specific?
and R right now.
Okay, so those applications have API interfaces. So with our insights tool, there is a way, and it all depends on each state's IT security requirements. So we're learning this along the way. But some states are okay for a secured API call, and it can call and pull that information directly into your third-party platform, whatever it may be, to analyze the data, the large data set. It's set up that way. Or there can be an export process where you can export that data file out to upload. We would prefer it to be a connection and API, so that's capable. You can also do, we get it that there's a lot of other data sets that you want to compare and link together, but you can also do some of those advanced analysis, like I mentioned, even within our insights tool. But it has the ability to connect via application interface to interface directly with your other third-party applications. Sometimes those third-party applications do have an additional charge for connecting via API to pull down data, but that can be implemented.
Okay, additional charge. And the other observation then is, like, for instance, something like comparing national benchmark to data, risk-adjusted data. The potential is that some of this data is going to be delayed by 120 days. So it's unlikely that we could do much in terms of current year. We would have to do anything would be the year before and beyond that, correct?
That's with our new product, that's where that changes. So coming next year, we will be able to support and allow, as we get more hospitals onto our new SaaS product, where it is near real time with our insights product. So if you're in a state that has an ESO product and can receive files, our new product will have the ability, like with NASEMSO, where it can be record locked. The state receives it, and you can do essentially near real time from the time the hospital validates and wants to record. Now, we wouldn't be transmitting things onto a state that hasn't been validated or completed. So it would be dependent upon, in that new world, dependent upon what your state's requirement is for a record to be complete and validated. But you would be able to do more real-time analysis within the same year instead of having it to be all retrospective a year behind.
Okay, thank you.
Does anyone else have any questions while we break right here for a second? I do know that Chris Ballard asked if we could put the URL for the survey into the chat or to the questions box, either one. I just didn't catch it in time.
I think Julie did.
Okay, good. Oh, there it is. I'll be quiet now. Go ahead.
So where I was going with this is our new registry. You guys seen that compliance timeline of 240 days, which is not optimal. We recognize that that's the age of the technology and why we're trying to promote and move people to the new and improved environment starting next year. And it will move our compliance process down to a 3-month process. Essentially, a state will tell us, and it will take us 30 to 60 days, depending on the level of effort and the amount of changes they have for that state. It will take us 30 days or less to deploy. It will be available near real time once we complete our analysis and update for the actual individual facilities, or for a state to push down to facilities to deploy. And there will be no lag time, downtime, time to have to schedule to update a server, to get a patch deployed, all of those fun things that currently exist, or not so fun things that currently exist, go away. And it's near 30 days or less, we say, because that's going to be dependent upon rolling out and doing education to facilities, or it's statewide saying, okay, our changes that we've adopted have been implemented, and we're going to turn on the switch on this date. And usually some folks like to do some education before then, but it could essentially be turned on like near real time. As soon as we're done, you all have the power as administrators to turn on and deploy those new data points near real time within our new application. And then the same with submission. So as soon as that's deployed and as soon as data is in there and validated, then data can be submitted. So we're taking what was a 240-day process and moving it down into a 90-day process to complete the actual compliance update timeline with our new product. However, our legacy products, unfortunately, will still be at that around 240-day timeline because of just the nature and the age of the technology to get it updated. That's really, we want to open it up for questions, just any questions you all may have, whether it's in regards to our new product, what we have plans to do in the future. We're here to partner. We want to know what questions you all may have. If you have a question, someone else is probably having that same question in the mind, and we'll try to answer it. If we don't know the answers, we'll get back to you with an answer. Are there any questions that you have for us here at ESO?
Well, since I'm asking all the questions today, I'll ask the most important one. Have you finished your pricing structure and guidance? That is something that my facilities are interested in, not only for the hospitals, but for the state.
Yeah, so great question. Be very candid. So we got lots of pressure in the beginning saying, hey, we know you're coming out with a new product. We need to know pricing. There's a big variable right now, and I will share with you guys. There's a big variable that's outlined and hanging with our pricing, in particular to a complete state system or a complete state package. And you guys are probably aware of the Office of the Health, the ONC, the Office of the National Coordinator, and the mandatory implementation of Fire Standard, FHIR, by all facilities and hospitals to exchange data, interoperability in a standard. And that does impact potentially Medicare reimbursement starting December of this year. So what that has resulted in is there is a new process for the Epics, the Cerners, the Meditechs, all the places of the world that would feed in data into the trauma registry to reevaluate their structure of data sharing. In the past, there was a very defined fee schedule associated with sharing data and API calls. We're working with our partners at these organizations to finalize and get their final take on what the fees associated with integrating and being able to pull data directly from EMRs are. So that's a big unknown right now, and has a big impact in what our cost would be and what the cost of a product would be. So long answer, we do have pricing available for our individual hospital providers that we can share with them. We don't have the pricing available for a complete state solution. We do, however, anticipate to have that in the coming months so that we can share with our state partners, especially those states that purchase the registry for all of their hospitals, and they want all of the integration along with that. So that's where we are. Unfortunately, we don't have the fee schedule currently for states. We do have it for individual facilities because we can go through that without the actual EMR linkage, because 90% of the hospitals right now do not have EMR integration with their registry, so we have that available. the integration with their hospital medical records is the one that causes a lot of question, because we're still waiting in limbo to get finalization from each of our partners within the record industry.
Thank you.
Now I will share, because we're with the states here, so I will share that there is we have a pricing structure that we share with folks, but there is a process. Obviously, you guys know this. There's procurement processes within each state, and if there is an RFP issued for a registry product, we do have an internal process for those types of responses and bids, where we would obviously within that bid put in our pricing. You may have heard, or you may know, recently we have partnered with the state of Virginia. We rolled out our state trauma registry there. We've partnered with them on rolling out stroke registry too. And those have all been through RFP processes. So we have a little different format for pricing. It's not like we just hand out our pricing. It's based off of what the actual bid is and all of what's encompassing for that specific state solution. So we do have a process through the RFP to present and provide pricing that way, but we don't just have a blanket fee schedule as to what our pricing is going to be overall for our products at a state level.
It looks like Joe has a...
Yeah, go ahead, Kelly.
No, you, Joe.
How is everyone? I hope everyone's having a good day. I've got just a couple quick questions. So on the new platform, I know for us, whenever we, changes are implemented and so on and so forth, even with us testing a new UAT, there seems to be a lack of regression testing because it goes into production and there seems to be further issues or other things that are affected that weren't identified, during the implementation. And do you anticipate with the new understanding, first off, too, a trauma registry is a very complicated software thing. I mean, it's not Microsoft Word, but do you anticipate less of those kinds of issues on the new platform going to the SaaS?
So Joe, yes, that is, we have to streamline and make this a scalable solution. Part of, in full transparency, part of some of those struggles that you're experiencing is just the technology. We can all be very candid. The last time that registry really got a good uplift from probably all of the vendors has probably been at least 15 years ago, when they started rolling out the current versions that most people are on. And that was built on really old tech debt and technology. You can imagine, you guys all know this, as soon as we walk out of our rooms, there's going to be another fast technology that gets released today or tomorrow that can improve efficiency. And with that, keeping that in mind, having that amount of age technology, the older something gets, the more maintenance, just like with a car, the more maintenance it requires and the more possibilities. If you change out one thing, something else may cause another problem, or you update something, it may cause another problem here. So we do absolutely anticipate that to be less of an issue and not be what you currently experience at the current rate, for sure. Part of that is just because of the way we're building the platform and the way that we will have templates for us to deploy compliance updates in a more streamlined fashion, instead of it being, for lack of better words, instead of it being customized code by each state client or each application in each version. So there are some states where they have multiple registry vendors there, and then each hospital may have a customized version of that product that they wanted to customize, which has custom code associated with it, or the state may have a customized product. And those, once we start into that custom data language writing, is really where we run into introducing the bugs too. With the SaaS platform, it will be multi-tenant, so everyone's data will be in their own, they'll have their own tenant, but the actual code and the code language and the platform does not change from one place to the next. It's simply you as an administrator configure your needs as to what gets turned on and off instead of us having to write that hard coded into the code. That's really technical talk, so I apologize. If I didn't do a very good job, please let me know and I'll try to clarify.
No, actually, for me, I grasped what you were saying for the most part. And then, so for the new product too, will there be availability of ad hoc reporting, like, you know, report writer, or are you developing your own, or is it going to be limited to the built-in reporting?
Yeah, Great question, Joe. That is so our insights product. I know I just highlighted on like the dashboards or how it could connect to via API to these other solutions and send big data sets, but it also has the ability where you can go in and build and configure a report specific to your needs. So if you only wanted to run a report on just all patients and their ISS score, you can that report is available, right, for you to, and you'll have all of your data points, because we understand the big thing is if there's a data point there that has data, then you can build it into a report, even if that's the only one data point you want to report on, or if you want multiple. It does have the ability for you to build out those reports, as you mentioned, similar to a report writer.
Thank you.
All right, this is Kelly. First of all, I'd really like to thank you, Garrett, and the rest of the ESO folks, including Julie. We appreciate everyone for coming, and we really appreciate that you took the time to just come and chat with the group. We did record this, so I'm going to hopefully be able to get it in a spot where somebody can, so somebody, one of the folks that, you know, if somebody was not here, they can go and watch it. And if y'all have any questions in the meantime, don't hesitate to either reach straight out to Garrett, or you can text your chair, Eileen, or me, and we can kind of get those answers over to ESO. The other thing I'd like to really just say is thank you so much for this bumpy ride with my first attempt here at running this webinar. So thank you for all the muting and unmuting and questions and chats and all of those things. Garrett, do you have anything else you'd like to say?
We just want to thank everyone for taking the time to join us, and we hope y'all would invite us back. If you have another topic or anything you would like us to explore more, we would be happy to dive into that. Please share with Kelly and the chair and the teams there at NASEMSO, from everyone here at ESO. Have a great day.
Bye. Thanks, everyone.
Thank you. Thank you, Kelly, so much. This is great.
Thank you. I got to figure out how to make it stop now.
You'll be fine. Yay. Goodbye, everybody.
Bye.